Hello guys, welcome back to my channel. On today's video I want to discuss with you about how to hand express your breast milk. Now the reason why you may want to hand express your breast milk is definitely within the first 5 days, let's say 4 days of your baby's delivery. So in the beginning, when you first deliver your baby, you will have only what's called colostrum. It's a very thick, very good quality milk that your baby needs. It helps them to clear out the meconium in the stomach, and also it helps them to really get all the benefits and all the antibodies that you have within your body, to give them a little bit of protection against any anything that you've been vaccinated against, such as if you had any flu vaccinations. Any antibodies that you have that's protecting your body, your baby will get it through your breast milk. For example, if you were advised to have the whooping cough vaccine when you were pregnant, this is one of those things where you can transfer the benefits of whooping cough vaccine to your baby's immune system. So colostrum is what you have in the first 5 days, let's say. It's very rich, very thick in consistency. It's not as liquidy as your full milk when your milk comes in. It's very yellow in color, and it's pretty hard to express it out. You certainly will not be recommended or advised to use a breast pump to express this colostrum, because it comes in very small amounts. It is enough for your baby to have only colostrum. So if you are feeding your baby through breast milk, it is totally perfect for your baby. Okay, so your baby does not need a top up for whatever reason, in terms of trying to satisfy your baby's appetite. So if your baby is on, full term, born well, healthy, you've gone home, everything is okay, and you've chosen to breastfeed, then absolutely colostrum is perfectly fine for your baby to have. Baby will get as much as baby needs, which is through feeding baby on demand. So you don't time your baby how often baby should feed, but you give baby as much as baby wants. Whenever baby gives you any feeding cues, such as nibbling on your, trying to look around, opening their eyes, maybe hand may go to the mouth, and this is why it's also very important that you keep your baby next to you as often as possible when you are within the first 5 days of your baby's birth, so that you don't miss any of these feeding cues. So the reason why you may want to hand express your colostrum or breast milk is, number one, is to help you get some colostrum out of the breast, and just to maybe sometimes to put it around baby's lips when you want to try and get baby to latch on, or just sometimes for you to even see that you do have milk, because sometimes mums can feel like, oh, I don't have any breast milk, there's nothing there, I need to give formula. Then they feel really under pressure to feel like they need to feed baby with something else. If you can hand express and actually see the colostrum come out, it gives you a little bit of a relaxation, bit of comfort, and it gives you a bit of reassurance that you do have milk and your baby will get it. The best way for colostrum to be extracted is through your baby's sucking. Okay, so no amount of hand expressing or even pumping can get your colostrum out as much or as well as a baby can do through sucking at the boob, at the breast. So when you want to hand express, what you need to do first of all is to first wash your hands. So good hygiene, wash your hands, make sure your hands are clean with soap and water. I've got a little knitted breast here to show you what I'm going to be doing and what you can do to help maximize the amount of colostrum you can express. Colostrum will come out, but it's not going to be in a great huge amount. Sometimes it'll be just in small little mils, maybe like 2 mils, 3 mils. It sounds really small, but this is very good because your milk is just starting to establish. However, when baby gets on, baby will get more than what you can express out. Okay, so first thing to do is to wash your hands, dry them. Make sure that you are comfortable in a position that you're sitting in, because you may be there for just a little while. So make sure you're comfortable, you are happy to do so. Most cases you may still be in hospital, so you can get assistance with it, and you can have either a midwife or breastfeeding support worker to come to your bedside to help you do this. You'll also be expressing this milk or catching the breast milk that comes out into a small syringe that you'll be given at the hospital, or they may give you a small cup to use, which will collect the milk, and you can feed it directly straight to the baby. If, for example, if your mom and your baby is in a special care unit or in ICU for whatever reason may be, they may ask you to hand express some colostrum for them to feed your baby whilst your baby is in a NICU, or in wherever, you know, baby, if baby's not with you for any emergency reasons that baby needed to be with special care. So this is one of the biggest reasons why people want to be expressing their milk as well. So once you've now, going back to expressing, once you've washed your hands and you're found a comfortable seated position and you're ready to express the milk, you will first need to start just massaging the breast and trying to warm up a little bit. So what you can do is to have your breast here, and you want to just massage the breast, and then just use a fist like this, just really gentle, nothing too forceful or really hard, and you just want to go all around the breast and just massage and push forward with your hand, just to like really get the colostrum flowing through the milk ducts that are in the breast. It's very important that you do not go straight to your nipple to try to express milk out. What the breast looks like inside is that you will have loads of vessels, blood vessels, and these things called milk ducts. You can look at them as though you've got like little grape seeds in your breast. These milk ducts are all inside the breast, and around the darker part of your nipple, the ducts will normally just finish or end just about here. So if this is the colored section of your breast, do not go like this, try to express milk. Don't hold this bit of your nipple. It's just going to be really painful. It's really sensitive with your nipples, and there will be not much coming out because you need to be pressing on the milk ducts which are in the breast. So you want to go back maybe a centimeter behind the areola, the darker part of your nipple, and you want to try and press down like this. You're pushing inwards and you're going forward. So I'll just come closer to the camera. So you want to go maybe a centimeter back from the nipple, from the areola, press down with a C shape like this with your hand, press down and just forward. Okay, you want to do that, and then you go to around the other side and press down, go around and press down, and go around and press down, and just hold. When you've got, if you feel the breast itself, you will feel some bits of lumpy bits, which is the milk ducts. So you just want to press until you don't really feel anything anymore, and that's where you end. And you hold on to it and you press forward, you press forward, and then you can move to another section, press and move forward. So you don't want to be doing this to your nipple or that. So your nipple is really not necessary for you to get your milk out. So you just want the milk ducts which are in the actual breast tissue. Okay, so it's over here that you want to go in. You press and move forward, and you're going around. If you're not getting as much as you think should be coming, you can then stop pressing, trying to get the milk out, and start to do the massage again, and go all the way around the breast, all over, underneath, and all of that. And then you come back again and you try to press down and forward. So I don't want you to be pressing down and moving your thumb forward or your fingers as doing this. You don't want to be doing that, because after a while you're going to feel really sore in the areas that you're pressing and rubbing and giving this friction motion. So what you want to do is just press down, so a centimeter from the areola, the dark part of the nipple, press down and just move forward like so. Okay, so you hold the breast, you press on it, and with the C shape, so this finger underneath, you're pressing, you're holding up here, and you're going inwards and down. So you're not rubbing and going forward, you're just pressing, moving the actual breast forward. So if you look at it as though you've got the grape in your hand, you press on it and then you just move the grape forward. So you're not rubbing the skin, you're just pressing down and then you're moving the skin or the butt that you can feel inside forward a little bit. Okay, and you can keep doing this. I think when you're trying to express colostrum, you shouldn't do it for too long because it might get a little bit, you feel a bit painful as well. It's a bit sensitive, so do as much as you can handle yourself, so you gauge and see. Even if you get in the first beginning when you're starting to express, if you get up to even 3 mil, 5 mil at each go, that's very good. The more you do it, the more you will make. Okay, because breast milk works in a way that the hormone that makes breast milk is called prolactin. What happens is you need to get this demand of the breast being demanded on in order for prolactin to be stimulated to say, okay, we need to make the baby's milk, we've been demanded, and now we need to make milk. So the more demand you give your breast, through either baby latching on and feeding or through expressing by hand or later on by a pump, then the more milk you make, because your body is then thinking, okay, we need to make more because we're getting demanded, and the hormone and the flow of it will get into sync at some point within the first few weeks of when you first start to breastfeed. So this is how you want to hand express. So first you need to wash your hands, get into a good position where you're comfortable to sit for at least 20 minutes to express. 20 minutes to half an hour is a good time to express, and then you start to express. Get all your equipment that you need to catch the milk into. You don't need to catch into a big bottle of baby feeding bottle, because you're just not going to have that much for you to tip it over and to feed the baby with. So you should be given a small either 5 ml syringe, which is specifically for collecting breast milk or colostrum, or a milk cup which you can express directly into, and you're ready to give that to baby. So this is not for you to store away. This is for the syringe you can store away. They will normally give you like a little label that goes onto the syringe to say when you expressed it, the date, and also who you are. So your breast milk, if it's going to be stored in, like, for example, a special special care fridges, then they will label it, make sure that it's going to go to your baby and all the rights and things like that. If you are going to express into a cup, it may be that you want to express and feed it directly straight to your baby. So you're with your baby in your room or in your side ward, and you want to just feed the baby with express milk. Sometimes you may want to express as well, just to see how much that baby is getting. It can be a bit of comfort for you as well to see that you do have colostrum and baby is getting the milk. So this is what you will need to do for expressing your breast milk. Sometimes it can also help, especially when you're at home, to do a little hand expressing, just to get your baby to latch onto your breast very well. Because once you go home and around day 5 and your milk comes in, which is when your full milk comes in, so it's no more colostrum, still has a bit of colostrum, but it's now much more. So when you hand express, you're going to get a bit more than just a syringe or a cup, so you can then do it into a bottle. But however, on a day 5 when your milk comes in, you might feel really full. There'll be a lot of milk, and it'll be really difficult for baby to latch on because the whole of the areola will be full. Okay, so when baby latches on, they can easily come off, and then your nipple, instead of being on the soft part in their mouth, it may slip down to the hard part, and this will be really painful for you. So we will always recommend to say just hand express a little bit, and then get baby to latch on, so just to smooth out the area that baby's gonna latch. And just one tip is to just inform you that baby does not need to latch onto your nipple. Okay, so if you are someone that is worried, am I even going to be able to breastfeed because I have either flat nipples or inverted nipples, is really not a problem. Please don't let that be something that you worry about, because all babies can breastfeed. Any nipple can feed a baby as long as you want to do it. What happens with flat nipples or inverted nipples is, as much as baby goes on, these nipples do tend to draw out, and your nipple is just purely for direction and a way out for the breast milk to come out. So your baby doesn't need to be on your nipple to feed. What baby needs to do is to get your nipple in the right direction, going in, getting sucked in, and then going straight to the soft palate in baby's mouth. Okay, so if you want to know what I mean by soft palate, let me know, and I will do a good video all about it, and latching baby on and all of that as well in another video if you wish. But what I mean by soft palate is inside your mouth. If you want to check, you can always see which part is your hard palate and which one is your soft palate. Quick way of showing you is to, if you just put the tip of your tongue just behind your teeth at the top and just rub it just there, that's very hard. If you tilt your tongue slightly towards your throat and lick at the back further down, you'll feel that it's much softer. So in your baby's mouth is exactly the same thing, it's just not so far back. So your nipple doesn't need to be big, it doesn't need to be long, it doesn't need to be pointy, it just needs to be there. It needs to be in the right position for your baby to get your nipple in the mouth. And then as soon as baby's got a good latch, baby does a really fast rhythmic sucks. This nipple goes straight back into the baby's soft palate, and then you have a lot of your areola into the baby's mouth, and therefore baby will be pressing again, like I said, on your milk ducts to get the milk into their mouth. If your baby is latched on to your nipple, baby will not be getting much milk, number one. You will be in a lot of pain because your nipple will be just on the hard palate of baby's mouth, and it's just not going to do anybody any good. So what you want to do is get baby to latched on, for your nipple to be facing the right way. And so as soon as baby stops doing his rhythmic fast sucks and starts to slow down to suck slowly, your nipple will move to the back. You should not be feeling any pain, and baby will be getting loads and loads of milk because baby will be pressing their lips on the ducts of your breast, which means it's further up on your dark part of your areola. Okay, so I hope this information was useful and you may now have an idea of how to hand express. And if you have any more questions, please do not hesitate to leave me a message or a comment, and I'll be more than happy to reply to you. Thank you so much for people that are watching my videos and people that are subscribing. I really do enjoy making videos, so if you do want me to make more content, or if you have anything that you want me to make a video about which you think it could benefit you or loads of other people, then please do leave it down below and I'll be more than happy to make a video for you. Thank you so much for watching, and I'll see you in the next video. And congratulations for anyone that's just had their baby or is due to have their baby. See you soon. Bye bye.